Good day. My name is Frank Mallicoat. I'm a news anchor and a reporter here in the San Francisco Bay Area for Fox, and I'm delighted to have Dr. Juhi Goswamy with us. She's a physician at Marin Health in Sausalito, California. Doctor, thanks for being with us.
Hi, thank you for having me.
I know you've been on the front lines. You've been in what they call a fever clinic when it comes to COVID-19. Tell us what that's all about.
Right, so initially the clinic was called a fever clinic. It's now called the Adult Acute Care Clinic. The reason being, traditionally the front lines is the primary care physician either sends a patient to the hospital or a patient directly goes to the hospital via emergency medical services, that kind of thing. Because of the upcoming surge, and the surge is happening now as we're seeing increasing cases, we decided to create triaging levels to decrease the burden on our system. So what that entails is we have the primary care physicians on deck. We are still seeing patients because patients do have other acute cares
Sure.
problems and medical problems that need to be addressed. And we're doing mainly telehealth visits to decrease exposure. The second line of the front is that we have a team of volunteers, of primary care physicians, that have signed up for shifts to do telehealth triaging for specific symptomatic patients. That means fevers, dry coughs, anything that would be resemblant of coronavirus. That is substantiated by a UCSF self-triage tool that Marin Health has worked with and incorporated into patients' charts. So this self-triage tool asks patients specific questions to help direct them to either telehealth via the COVID triage or to their regular primary care physician. The third layer is now what you refer to as the fever clinic, otherwise known as the Adult Acute Care Clinic. So Adult Acute Care Clinic has two components. One, we have a drive-through tent where by physician referral, we do on-site testing. That includes nasopharyngeal swabs, so a swab through your nasal sinus to try and test for a patient for coronavirus. That then goes to our local Quest or local laboratories that are present, and we try to have a turnaround between 5 to 10 days. The clinic aspect is if a telehealth provider or another physician on the primary care physician feels that their patient needs to be evaluated in person, we bring the patient in. Obviously, we have proper personal protective equipment standards, and the clinician that is also a volunteer, I'm on site one of the days. The clinician will determine through a patient's history and symptoms and physical exam whether or not a patient qualifies as moderate or severe symptoms. And that includes a triage as far as their comorbidities or placing them in a higher risk group. Then the clinician will do a nasopharyngeal swab and send that in. This is a step in between sending a patient to the emergency department or not. At the site, we're able to do things like EKGs to see if their patient has chest pain. We're getting a portable chest x-ray machine. And we're also, because if we have high suspicion or concern for patients, but not enough to send them to the emergency department, we also provide them with pulse oximeters. So that we have them follow up with our telehealth docs, and we have them monitor their vitals.
So before someone goes into the ER, you've got quite a few layers there to not overflow the ER. That sounds like that's what that's all about, right?
Well, it's not to not overflow the ER, but it's also to decrease exposure to otherwise patients. We're seeing patients that are have other symptoms, heart attacks, stroke symptoms that are not presenting because of fear of the coronavirus. And, our healthcare systems are well aware of that. And we want patients to understand that if you do have an emergent problem, you should come to the hospital. And, we are aware of the exposure risks, and we're trying our best to help decrease them.
How many patients actually have been diagnosed since you've been going through this with the coronavirus? We're certainly not New York or Italy yet, but I imagine It's getting worse, right?
Right. So Marin itself has 108 cases as of today, and unfortunately 6 deaths. from the coronavirus. We are seeing the numbers increase, and the surge has started. This is not to say that the Bay Area, Marin County, San Francisco has not been doing a great job at self-quarantining. And I would like to take this platform to thank everyone that has self-quarantined and self-isolated. I can only imagine how hard it is to do that. However, by doing that, you're protecting not only your loved ones, but your neighbors, the vulnerable population. I live in San Francisco, and yesterday I walked by Alta Plaza Park, and unfortunately, I did see people that were not social distancing. So my fear is that people are reading articles that are saying that the curve is San Francisco is being successful in flattening the curve. Yes, our efforts are successful so thus far, but I don't in any way want to de-incentivize people to discontinue their behavior. And please continue to self-quarantine. As you saw, the home shelter has been extended.
Yeah, our world is changing. I was at Costco the other day. I have a mask. I thought, oh, I'm okay. I'll go in and keep my distance. And I saw the line. I thought, no, you know what? It's time. It's time. If you're going to go grocery shop, you're not only doing yourself some good, but you're also protecting others as well.
100%. And, keeping that 6 feet distance, I can't emphasize how important that is. There is new data coming out every day. Things are changing, guidelines are changing. But what we do know is if you can keep a 6-foot distance from people, and if you're symptomatic, do wear a mask to protect others around you. That's so important.
What do you say to those folks out there? I mean, we all get a cold every now and again. You might have a low-grade fever, sniffles, and everyone jumps to the conclusion, oh my gosh, you got the coronavirus. And like you said, you might have some other issues, but you're afraid to go to the doctor. And I guess that's where the teleconferencing comes in, right?
Right. And I can't emphasize how much admiration I have for our Marin Health community, as well as our community members, because, everyone's learning day by day. I've had patients that I otherwise see in my clinic, and we do talk about symptoms that are low grade. And the majority of patients with coronavirus will have low grade symptoms, and they will get through it. The question is, it's very difficult to differentiate. Is this adenovirus? Is this another type of coronavirus? Is this the COVID-19 virus? So the question is, because anyone that's symptomatic, we are asking them to self-isolate, not only self-quarantine, if possible. Now, that being said, it's easy to give recommendations, but when you don't have the resources and the ability, if you're living in a 1-bedroom apartment, that kind of thing, right, just try to clean your surfaces, try to wear a mask if you are symptomatic.
I heard this actually in another interview I did. A doctor told me 48 hours before you may even start showing symptoms, you can still be contagious. So someone could be waiting in line at a grocery store right now, feel fine, and yet still be spreading it.
I love that you brought that point up. Yes, 100%. Actually, the incubation period is about 5 to 7 days. So for 5 days, you can do the math. I'm terrible at math, but for 5 days, a patient can be shedding the virus and have no symptoms. And at times, you can even have a subclinical infection. And what that means is you don't have symptoms throughout, but you may have had the coronavirus.
And can I tell our viewers out there, by the way, this is Frank Mallicoat. We are in San Francisco talking with Juhi Goswamy. You've only been practicing now. You're out of your residency in Miami, just 6 months, something like that?
Yeah, so I actually graduated my residency in July of 2019. So okay, within the first year of being on the grounds, we are experiencing a pandemic, and every day is a learning opportunity for me.
I welcome to doctorhood, right?
It's an enheartening awakening because I see the reason why people went into medicine, and this is in a way our own war, and we're going to get through this.
What kind of precautions do you take? You're still seeing patients, I would imagine, in Marin, correct?
Of course. So the precautions we take are we're actually trying to do mainly telehealth visits, unless we think a patient that is not coronavirus symptomatic needs to be evaluated in person. That means, a clot, a broken bone, that kind of thing. The precautions that we take is outside of our consulting room, we do maintain a 6 feet distance from each other. We have hand sanitizers, hand washing. The hand sanitizer has greater than 60% alcohol content. We use masks. And we always ask patients about their symptoms. We take their vitals. Am I answering your question?
No, yeah, absolutely. And I can't stress this enough, how our world is changing. But through teleconferencing, do you see this as a wave of the future to let people get diagnosed, at least that first layer at home before they rush into, say, your office down the road once we're beyond this?
So that's a loaded question. I think that telehealth has saved us in a way. Right. In the course of 24 hours, our whole system converted from from in-person visits to telehealth. There is the art of medicine that requires a physical exam. And there are things that we do find, but the majority of issues we can help triage and kind of assess, do we need to bring this person into the clinic? That being said, I'm not sure where telehealth will go.
Right. Well, it's a brave new world any way you look at it. Let's look back east to New York and the devastation in New York City right now. And of course, what's happened in Italy, which seems to be peaking at least, their cases are getting lower and lower. Do you see that, even though we are social distancing and obviously here in San Francisco and around the Bay Area, I think we're a little bit ahead of the curve. At least I hope we are. But do you see some of that coming? This is going to get a lot worse before it gets better.
Right. It's not fun to say this, but I do see a surge coming. And in fact, we are seeing the beginning of the surge. I think the difference between San Francisco and the Bay Area and New York is much more densely populated. Right. And if you look at the timeline, actually San Francisco, the county itself declared a state of emergency despite having no cases on February 19th. Now on March 17th, a shelter in place was mandated by Governor Newsom. That being said, I think we were ahead of the curve in trying to abate the surge, but I still do think that we are going to have a surge, and that is why the federal government, Governor Newsom has been amazing as far as calling, health professionals to action. Health professionals don't only include doctors, but the nurses, the respiratory therapists, the paramedics, the emergency services, the phlebotomists. It's just so important.
Well, you spent a lot of time in Florida with your residency in Miami and Fort Lauderdale. Have you been in touch with some of your doctors and colleagues back there? How is Florida dealing with this?
I have. Florida, I think, acted a little too late as far as the quarantining regulation. It really broke my heart seeing, the South Beach partiers. We are seeing the sequela of that. I can't speak for the actual cases because I'm not on site, but there are definitely increasing numbers as the days go by, and there are increasing deaths.
Can you talk about, I think it bears repeating, and I ask everyone the same question, but kind of the do's and don'ts. What should we be doing besides staying home to take care of ourselves?
So, thank you for asking me that. It's, one, of course, like you said, self-quarantining, okay? 2, hand washing. It is so important to wash your hands, not touch your face, because any virus can be transmitted through any mucosal surfaces, mouth, nose, eyes. That being said, and I just moved my hair and I went against my own advice.
I know, I talk with my hands a lot. I'm sitting on them right now, but it's amazing when you start, it's kind of like breathing. If you think about breathing, it becomes laboring. But you think about your hands and, oh my God, I touch my face, every minute, it seems like.
Right. So it's a second nature, and that's something that we have to constantly remind ourselves not to do. Clean things that you don't think of, like keep your shoes outside, clean the doorknobs, your toilets, your counter surfaces. I'm sure people do clean the counter surfaces. Make sure that, if you don't have the wipes available at the grocery store, use just basic soap and water. That should do it. Now, if you are symptomatic, please, please, please be forward with those that you're living with and try to isolate yourself. You can still share the space, but if it's possible, try to isolate yourself.
How about mental health? Because a lot of us are frazzled. You live in San Francisco. It's densely populated, although the streets are pretty bare. People are taking good care. But for those that are just worried,
right. I actually appreciate that you're asking that, because when patients come to me to establish care, I say, there is body health and there's mental health, and both are equally as important. For mental health, one of the things I find, even for myself, is, establishing a routine. Right. A routine is so important. Having a hobby, whether that's simple things like cooking or drawing, or even reaching out to a friend every day, to Skype, Zoom, WebEx, whatever you can do to have that emotional contact. If you have a neighbor that is vulnerable and old, reach out to them, say hello. I know Governor Newsom is starting an initiative through the Health Corps for that.
Yeah, well, thanks to social media, I know we're all reaching out a lot. I've been on the phone. I'm trying to call at least one old friend that maybe I haven't touched base with in a while every day, just to keep them in the loop. And I know my sister's by herself, so I call her every day, 2 or 3 times a day, just because we need that social interaction. That's what we do, right?
Right. And I would like to say that if you have anxiety, if you have depression, if you have another bipolar depression, schizophrenia, a psychiatric illness, please, if you think that it is flaring, if it's difficult to manage, reach out to your provider. And if you don't have a provider, reach out to a hospital, because there is support, and we can support you through telehealth, through services. So please don't avoid doing that.
So we go out shopping, we pick up a few things. You might have bumped someone, you're wearing clothes. I'm sure you go home because you're in a doctor's office. Should we feel like doctors go home, shed our clothes, wash them, jump in the shower? Should that be our daily routine if we go outside?
That's what I do. I, of course, am high risk because I am working in the adult acute care clinic. Sure. But I do believe that if you go outside, we don't have enough evidence about transmission. So I leave my shoes outside. I wash my hands. I actually wash my hair every day. Take a shower. Make sure you're washing under your nails if you do have nails. I can't emphasize enough the importance of continuing your daily lifestyle with these new parameters.
And what is your take on wearing or not wearing a mask if you go out now?
So I don't, per the WHO and the CDC guidelines, if you are not symptomatic, you don't need to wear a mask. However, I know the Surgeon General has asked the CDC to do some investigation into whether this is airborne or not. There are some studies that are coming out that are saying that there might be some airborne transmission, although the density of the droplet that is expelled is too heavy at this time that we know of to be remnant in the air.
Human interaction. I'm a hugger. I shake hands a lot. I've got to change my habits. Do you think down the road, when hopefully this is behind us soon, that the way we greet people, the way we interact is going to probably change maybe forever?
I have to say there are always silver linings, and that is definitely one of the brighter ones. I have seen our community members band together. I have heard from friends checking in on me and saying, I can't wait to hug you. I can't wait to value you as a human being. Sure. And in this age of social distancing and internet connections, I think we're going to value in-person connections even more.
Shelter in place, last question, set for May the 3rd, at least here in the Bay Area in California. And that got pushed up once already. Do you see that as a realistic goal with what may be coming our way, what New York is seeing right
So numbers don't lie. Okay. So if you look at the data, obviously I can't predict the future, but I do believe there's going to be a peak by the end of April, beginning of May. When I say a peak, that doesn't mean that we've won. That means that we're seeing the most number of cases, and hopefully the caseload goes down after that. That being said, I do think that the shelter in place might be extended for correct reasons. I can only imagine how burdensome that might be on small businesses, that kind of thing. But I think people do need to go back to work, but we need to redefine what that means.
Yeah. Let's leave on a thoughtful note. What do you do to make yourself happy when you go home and kind of debrief yourself from what I'm sure has been some long days?
What I do, I actually have taken up reading a book. I'm reading Jeffrey Archer right now. I have a Cavapoo puppy, so she brings me a lot of joy. And I definitely, like you, I'm trying to reach out to someone new every day, and I always check in with my family too.
Very good. Well,
working out.
What's that?
I also try and work out. So.
Yeah, I must admit, I'm into yoga, and I'm a gym rat, so I'm at the gym a lot. Of course, that's locked up. So I'm doing videos and sweating on my living room carpet now, and trying to stay in shape and stay healthy like all of us. So it's all
That's
good.
So important, and thank you for doing that.
Very good. Well, Dr. Juhi Goswamy, hey, thank you very much for taking the time. Some great insight, and stay healthy. We so appreciate what you're doing, and let's get through this.